Transfusion-transmitted diseases. So blood components undergo rigorous testing and screening to ensure they are as safe as possible for transfusion. The risk of transfusion-transmitted diseases, such as infections caused by bacteria, virus, parasites, or prions, is extremely low due to these safety measures. However, it is important to recognize that pathogens continuously evolve, and some may escape detection during testing. If such pathogens are present, they can potentially cause serious harm or even be fatal to the recipient. Because of this, blood banks and regulatory agencies remain vigilant, continuously updating testing protocols and monitoring emerging infectious threats to maintain the highest level of blood safety. For donor testing, the required serological testing that is performed on all donor units include hepatitis B surface antigen, antibody to hepatitis B core antigen, antibody to hepatitis C virus, antibodies to HIV, antibodies to HTLV, syphilis, HCV RNA, West Nile virus RNA, and HIV-1 RNA. Confirmatory tests are essential to verify initial positive screening results and reduce the occurrence of false positives, ensuring accurate diagnosis and donor eligibility. Different diseases require specific test methods, including polymerase chain reaction, or PCR, which amplifies and detects the genetic material of pathogens, allowing for early and precise identification. Can also be done by Western blot, which detects specific proteins of pathogens by separating them in a gel and using antibodies for identification. Another one is radioimmunoprecipitin assay, a sensitive technique using radioactively labeled antibodies to detect specific antigens. The next one is recombinant immunoblot assay. This is similar to Western blot but uses a recombinant protein to improve specificity. While blood screening tests cover many of the major pathogens, there are numerous other organisms that can potentially be transmitted through transfusion. These include certain bacteria, viruses, parasites, and emerging infectious agents. However, routine screening for many of these organisms is not performed during standard blood donation testing due to factors such as low prevalence, lack of approved testing methods, or cost-effectiveness considerations. Continued surveillance and research are essential to identify new risk and update screening protocols to ensure ongoing blood safety. For hepatitis overview, so hepatitis refers to inflammation of the liver, which can be caused by various viruses. Common symptoms include jaundice, which is yellowing of the skin and eyes, dark urine, enlargement of the liver, loss of appetite, general malaise, fever, nausea, abdominal pain, and vomiting. There are different types of hepatitis viruses. These are classified mainly by their mode of transmission. So hepatitis A and hepatitis E are primarily spread through fecal-oral route, often via contaminated food or water. Hepatitis B, C, D, and G are mainly transmitted through blood and other bodily fluids, which can include transfusions, needle sharing, or other exposures. For West Nile virus, this belongs to the flavivirus family. It is an important pathogen that affects humans, birds, and horses. West Nile virus is a single-stranded RNA virus with a lipid envelope. This virus primarily affects the nervous system, causing neurological disease in its host. Cytomegalovirus, or CMV, is a member of the herpes family. It can cause serious infections, especially in certain high-risk groups such as fetuses and immunocompromised patients. Individuals who have undergone bone marrow transplants or solid organ transplants are particularly vulnerable to CMV infections. Epstein-Barr virus, or EBV, is a ubiquitous member of the herpes family, commonly found worldwide. Although transfusion-associated Epstein-Barr virus infections are rare, there are documented cases in medical literature. Current blood screening practices do not detect Epstein-Barr virus, which poses a risk, especially for immunocompromised patients, such as those who have received organ transplants, where infection can lead to severe complications. Parvovirus B19 is a small single-stranded DNA virus that is non-enveloped. So during the viremic stage, which occurs shortly after infection, an infected individual can transmit the virus even if they show no symptoms. This asymptomatic viremic period is a significant concern for donor centers because the rate of seroconversion, which is the development of antibodies after exposure, is high, increasing the risk of transmission through blood donations. Bacterial contamination. So although the overall incidence of transfusion-associated bacterial sepsis is low, the morbidity and mortality rates related to these infections remain high. Platelets are the most frequent source of septic transfusion reactions due to their storage conditions, which can promote bacterial growth. This makes vigilant screening and handling of platelet products critical to reducing risk. For syphilis, or Treponema pallidum, this is the causative agent of syphilis, and it is a spirochete bacterium. Standard serologic tests for syphilis often fail to detect donors during the spirochetemia phase, so that's before seroconversion has occurred. So despite this limitation, the standard serological test for syphilis remains a required screening test for blood donors. Notably, a federal advisory panel recommended eliminating this requirement back in 1978, but it is still in place. Babesiosis is a zoonotic disease typically transmitted through the bite of an infected deer tick, and it has been associated with some fatalities. Trypanosoma cruzi is a flagellate protozoan and the causative agent of Chagas disease. It is naturally transmitted through the bite of the Ruduvid bug. Malaria, especially from Plasmodium species. So this is an intra-erythrocytic protozoan infection, which is caused by several species of the genus Plasmodium. Creutzfeldt-Jakob disease is one of the transmissible spongiform encephalopathies. The causative agent of all spongiform encephalopathies is believed to be a prion. So this occurs sporadically, and it can be inherited. It can also just be acquired through medical procedures. There's also a variant, Creutzfeldt-Jakob disease, and this affects younger individuals, and it's linked to bovine spongiform encephalopathy, or mad cow disease. So considerations for blood donations, there is no reliable test that exists for asymptomatic carriers. So donors with connections to the UK and certain parts of Europe are deferred due to, to reduce this risk. So viral inactivation methods in blood product. These methods help reduce residual risk associated with serological window periods. So that's the time before the antibodies are detectable. Virus variants that might escape detection, laboratory errors in organisms that that just aren't routinely tested for. So historically, coagulation factors had a high rate of viral transmission until the early 1980s. And viral inactivation methods have significantly improved blood safety since then. Lipid enveloped viruses include your HIV, hepatitis B and C viruses, and then your HTLV, which is your human T cell lymphotropic virus, Epstein-Barr virus, cytomegalovirus, and your human herpes viruses. These viruses are effectively inactivated by organic solvents and detergents. So current risk of transmission of enveloped viruses is very low due to combined treatments such as heat treatment, solvent or detergent treatment, and nanofiltration. These methods are not effective against non-lipid enveloped viruses such as hepatitis A and parvovirus B19. All blood banks and transfusion services must have a process to detect complications related to transfusions, report and evaluate complications, including development of infections such as hepatitis B or C, HIV, and human T-cell lymphotropic virus. A method to notify donors of any abnormalities found during the pre-donation evaluation, laboratory testing, and recipient follow-up stages is all required. For a look-back procedure, so donations that test positive for hepatitis B, C, HIV, or human T-cell lymphotropic virus cannot be used for transfusion. All prior donations from donors who tested positive become suspect. The timeline and standards for implementing the look-back procedure will vary depending on specific diseases that are involved. Any prior blood components that are still within their expiration date must be quarantined. The disposition of these quarantine components depend on the results of the licensed supplemental test. If it is confirmed that a patient has developed hepatitis B, C, HIV after receiving a single unit from one donor, that donor is permanently deferred from future donations. If the recipient received blood from multiple donors, it is not necessary to exclude all donors. The implicated donors may be called back for retesting. So after a donor is implicated, other recipients who received components from the suspected donor should be contacted as well. The donor must be placed on the appropriate donor deferral list if subsequent tests return positive. Donors who are permanently deferred due to positive test results must be notified of their status, and all reporting requirements related to these cases must be followed. For autologous donations and reporting of transfusion-transmitted diseases, so autologous donations that are positive for these can still be used because it's going back to the patient. So if these units are not transfused at the collecting facility, the collecting facility must notify the transfusion service. Testing must be repeated every 30 days on at least the first unit to be shipped. Information about any abnormalities must be communicated to the patient and their physician. And any fatalities due to transfusion-transmitted diseases must be reported to the director of the Center for Biologics Evaluation and Research within 1 working day, followed by a written report within 7 days.